This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. Drug addiction. It's a vicious cycle you do not want to get into.
It entails the fact that you are taking an illegal substance or medication, and then you tend to abuse that medication or illegal substance.
According to the Dangerous Drugs Board, 1.7 million Filipinos are hooked on dangerous drugs. The most commonly used illegal drugs and substances in the Philippines are methamphetamine hydrochloride or shabu, cannabis or marijuana, and inhalants such as rugby and contact cement. The red flags are just about everywhere.
For instance, shabu. The dependence, hindi ko minsan nakokontrol yan eh. Kasi you will feel the pleasure, the feeling of being relaxed, the feeling that you forget your problems, tapos nawawala yung stress mo, akala mo lang yon. And then, once na you're hooked on it, eto na yung possibility na magtutuloy-tuloy na to into addiction.
Drug addiction can destroy your family and can interfere with your work and relationship with other people. Everything starts with an active decision to understand the harmful effects of these dangerous drugs on your physical and mental health.
Giging disorder kasi hindi mo mapigilan yung thoughts mo na kailangan mag-take ako nito kahit na hindi kailangan. Such compulsion can produce anxiety, can produce panic, may stress out ka, magkakaroon ka ng tension, restless ka, until you become aggressive na to the point na parang hindi, tapos uncontrollable na yung behavior.
What are other drug addiction symptoms or behaviors? What are some long-term consequences of drug addiction? Find out the answers tonight on MedTalk. And joining us tonight is Dr. Alfonso Villaroman, an addiction specialist and the program director of the Department of Health, Treatment and Rehabilitation Center in Taguig City. Also with us is Professor Rodrigo Lopida, a certified counseling psychologist and a licensed psychologist from the Center for Christian Recovery and Agape Rehabilitation Center. You may join our discussion by calling our hotline at 548-4678. Good evening, Professor. Good evening, Doctor. Welcome to MedTalk.
It's nice to be here.
Tonight's topic, drug addiction. How would you define drug addiction?
Well, drug addiction is a condition of a person where he continuously reuses drugs, despite detriment to his health, despite health problems, legal problems, or other problems that may entail because of the drug use.
Yeah, it is also a disease of the body, the mind, and the spirit. And it is characterized by obsession, of course.
When one is really obsessed with anything, you really have no control over your mind, your body,
Yes,
and your spirit.
definitely.
And how does this obsession develop? How does it start,
Well,
Dr. Villaroman?
Obsession, we may call it, I would rather term it as compulsion to use drugs. A person dependent on drugs usually manifests with behavior that he constantly seeks to use drugs, to obtain drugs and use. Hinahabol niya yung satisfaction, yung high na nakukuha niya. This is a result of changes in the body, particularly in the brain, that occur because of continuous drug use. The professor was right in saying that it is a sickness of both the body, the mind, and the spirit, because lahat yan na nagiging complications. At the same time, because of the constant drug use, apektado rin yung normal function ng patient day to day. He na-affectuhan yung kanyang work or study. He's unable to cope with the social demands that are given to him. He develops problems like unemployment, becomes out of school. He also develops legal problems as a result, probably from stealing or doing other things that target obtaining money to buy drugs.
So because of all these factors that affect this individual, has it become, or is it a disorder? Is it a
Yes.
disease? How would you classify it
Actually,
in
we
medical
classify,
terms?
it is actually part of a mental disorder.
Yeah.
It is a mental health disorder. But aside from that, it's more complicated than that, because if you use the drug or use drugs constantly, it can also affect your body. You can develop symptoms like, for example, HIV for IV drug users, or you can develop other disorders. There's one common problem that we see in patients constantly using meth. It's called meth mouth. The teeth fall out, they decay. Aside from that, they develop other disorders like cardiovascular disorders or renal disorders as a result of constantly using drugs, or even other medical problems.
Yeah, it is also included in the DSM, or the Diagnostic and Statistical Manual for Mental Disorders, and also ICD-10. So
What is the
chemical
ICD?
dependency is also included there. The International Classification of Disorders, and the Diagnostic and Statistical Manual for Mental Disorders.
Actually, it's a basis for psychiatrists and addiction specialists use DSM and ICD-10 as a basis for diagnosing patients. One of the highlights of DSM, it's actually dalawa yan, American ang DSM, ang ICD-10 is British. But one of the highlights of DSM is, for example, continued use despite yung detriment to health, despite continued use despite legal problems or consequences, continued compulsion to use, symptoms of withdrawal, and others. So these are part of the things we find in the DSM classification.
And in spite of all these consequences or the detriment to one's health, there are still a lot of people who are addicted to these types of substances. Why is that? Why is that so?
It's masarap eh. Really,
Okay.
it gives them a high, the euphoria. I'll give a good example. It's the stimulants, particularly methamphetamine hydrochloride, which is more commonly called shabu. When a person is exposed to that substance, he will feel an intense euphoria. It's a stimulant. So, ang feeling niya, he feels strong, invigorated, he feels tireless. In fact, a lot of professions that entail long hours of work, like driving long distances,
Yeah.
or even working in studios, or security work. These are people that are prone because they feel that their function is enhanced. The problem is it sets the stage for changes in the brain, particularly, because when you take shabu, there is a flood of neurotransmitter or chemicals in the brain that cause this severe or extreme euphoria. So this is not normal, because normally we have chemicals that make us feel good. And it attacks targets in the brain, particularly those for pleasure and memory and learning. So addiction, some say that once you're exposed, you're on the road to addiction. But there are some people that are genetically predisposed to addiction, and studies have shown this. Some people might be exposed to the drugs, but will never use again later in life. But in a certain percentage of people, once they're exposed, it really triggers them to use and reuse until the time that they get affected na.
Yung parang they totally lose control of what it is to feel good without the drug, and to have that feeling of a certain high when you're using this substance.
We call it the X factor. No?
Yeah.
Meron tao na talagang predisposed, na pag gumamit siya, ay tuloy-tuloy na yung progression ng addiction. Meron man tao na gumamit isang beses lang, pero ayaw niya kaagad.
But the problem is, with addiction kasi, with the person when exposed to the drug, nagde-develop siya ng, the first time you use it, it's so intense.
Yeah.
And because of that, some people are driven to try to get that same high again. However, if you use and reuse, there's a certain phenomenon that happens called tolerance. You have to take more and more of a substance to get that same effect. So that also increases the chances for you to become addicted.
Okay. So parang your goal is to get that same high that you got from the last time you
Yeah.
took the
Yes.
substance.
At
And
all-
at
sorry.
all costs. Yes.
Yeah, at all
Yes,
costs.
Professor.
I had one case. No? Yung plato niya, no, inuhugasan pa lang niya, binibenta na niya sa kapitbahay. Yung plancha, mainit pa, binibenta na sa kapitbahay.
O yung sinaing na nanay, pag-ikot ng nanay, nakita na wala na kaldero, usok na lang natira.
Grabe, that's how fast it is, and that's how much you want the substance, no?
Yeah.
That's how much you want it. And how will you recognize that someone is into this behavior? What are the signs and symptoms of one na, like what you mentioned, no, yung at all costs, gagawin niya talaga just to get this substance? Telltale signs.
Depende sa drug eh. Like for example, in marijuana, it's very
Yes.
easy. It's a hallucinogen. And many times you can see the people may red eyes, tapos ang kilos niya iba, parang detached from reality. Other times, they look lasing, especially if you take barbiturates, you know the itsura of a person who's drunk,
Yes.
staggering, slurring speech. With users of methamphetamine, you usually find them very hyperactive, very talkative. Their eyes are a little wide open, their pupils are dilated. Ganun ang epekto sa kanila, and then they medyo dry ang mouth. Ang nakikita talaga natin sa result ng addiction is more on the collaterals. Yung epekto sa pamilya, sa kanilang trabaho, that's what we more see. When we examine our patients, we don't use the drug test alone as a basis for being an addict. It has to be a history, long history. And usually you can get that not only from the patients but from the significant others like their wife, the parents, or the children. And many times nakikita nila progression. Nag-uumpisa yan, hindi mo na papasok na ilang araw or whatever. Tapos makikita mo na hindi na siya pumapasok or mawawala ng certain number of days only to come back. And then when he leaves, there's always something missing in the house. So these are the things, Mawawala siya ng job and he's all constantly trying. Ang direction talaga ng life is to obtain money to buy drugs. And that is already a stage where we usually have to intervene talaga and bring them to a facility.
So that's a very extreme case already where it's very obvious already that this person needs help.
Yes, a lot of times, there are a lot of people here that use drugs but can still function. But, until a certain extent, when their use becomes heavy, hindi na nila makope yung normal demands ng life. And nagpapalit yung kanilang preferences. They prefer being with people who use drugs instead of being with a family or going to work. They prefer, being alone, or you can see certain routines.
And it's a very noticeable change, no? Kasi as you mentioned, Doctor, it's a progression.
Yes.
Professor, briefly, yes.
Yeah, I'd like to add
Yes.
an example. A basketball player. Initially, ang gusto lang niya, lumakas siya sa paglalaro, gumaling sa paglalaro. Nagtitake siya ng drugs until such time na nagtitake na lang siya ng drugs at hindi na siya nagbabasketball.
Ay, nakakasira ng family, ng career, ng work, we'll learn.
Tsaka ng ulo.
Ng ulo. Literally, no? Because it affects the brain. We'll talk more about drug addiction, the signs and symptoms. There are certain myths that surround drug addiction. All that and more when MedTalk returns.
According to the Dangerous Drugs Board, the ratio of male to female drug users is 10:1. Generally, women are more prone to abusing prescription drugs because they use it more often.
We're back here on MedTalk, still talking about drug addiction. You may join our discussion by calling our hotline at 548-4678. This time, Dr. Professor, let's talk about the myths surrounding drug addiction. Myth number 1, prescription medications are safer to abuse than other illicit substances.
Wrong. Any medication has a propensity for addiction or dependence. Actually, there are two types of dependence. There's psychological and physical. Physical dependence, ang highlight nito, nakikita mo usually withdrawal symptoms. They appear usually when the drug stops. You stop the drug intake. Ang hallmark naman ng psychological addiction or dependence is severe craving. So, theoretically, any substance can be subject to addiction.
And when we've been mentioning that it affects the brain, nakakasira ng ulo, there's the expression that your brain gets fried. Is this irreversible?
In a lot of cases, particularly in abusers of marijuana and methamphetamine, we've seen that when patients develop psychosis, usually they have to take medications for the rest of their lives just to control this. A lot of times, we also see patients who take prohibited substances as a form of self-medication because some of them already before had already symptoms of psychosis. So parang nakakatulong daw sa kanila to remove the voices in their heads.
Nakakatulong ba talaga?
No.
Okay.
At some point,
Baka nakakadagdag pa yun.
Yeah. In fact, it's like feeding fuel to the fire, It's very sad to say that a lot of patients talaga that become addicted to substances, it takes sometimes their whole lifetime to recover. And the professor will agree with me here.
Yeah. And meron din tayong tinatawag na comorbidity. No? Yung iba na may, for example, bipolar disorder, they abuse drugs.
Yes.
Yung iba na may major depression, they also abuse drugs.
Comorbidity means that there is a psychological, psychiatric, or physical medical problem aside from the addiction.
And this develops because of the addiction, or is this prior to the
usually,
addiction?
when you abuse drugs, you can develop comorbidities. But like I said kanina, some patients have this tendency to, like, may family predisposition to mental disorder. And if they take drugs, it's like already setting the stage to full-blown psychosis. Unfortunately, when you develop these symptoms, like I said, you have to really have chronic management.
You mentioned earlier, Dr. Marijuana. Myth number 2, marijuana is not bad for you.
Well, contrary to that belief, it is bad. Studies have shown that there are very varied long-term effects. I may mention psychosis again. A lot
What
of
exactly
patients.
is psychosis?
Psychosis is a mental condition where patients, maraming yan. Meron schizophrenia, meron mga, they develop voices in their heads, they start behaving bizarrely. If you see in the streets sometimes, especially in EDSA, you see some tao grasa.
Yes.
That's exactly how a patient sabog sa marijuana looks like.
Yeah.
They're detached from reality.
Talking to themselves.
Yeah. Well, you see a lot of them also using other drugs. But with marijuana in particular, you have a lot of, there's such a thing as a lot of syndromes that happen because the effect of marijuana is longer. It takes much longer for the body to rid itself of the chemical, which is tetrahydrocannabinol. And it competes with certain receptors in the brain that look like the marijuana or the THC molecule. So much so na nabablock ito, and it's fat soluble, and the brain is like almost, the solid part of the brain is almost 100% fat, no?
Yes.
So it takes a very long time for it to be metabolized. At the same time, there's a phenomenon that they call a motivational syndrome. This is when a patient loses the drive to strive, to improve himself, to study. It has also long-term effects on memory, long-term effects also on childbirth, on reproduction, sexual erectile dysfunctions or other sexual dysfunctions are found with increased use in marijuana. And may I also add that there is a 5% increase in the chance of developing myocardial infarction with people after they inhale marijuana. So the effects are really a lot, And most of them are really chronic, and it takes a very, very long time to rehabilitate them.
In spite of the news items or the other information being passed on about marijuana, that it can be used for medical purposes. What do you think of that,
Another
Professor?
is the what we call delusion. They suffer from delusion also. Delusion of grandeur, a delusion of persecution, etc.
Paranoia.
Paranoia also.
But you also see that with stimulant abuse.
Yeah.
But what you were mentioning,
Yes.
very, very touchy on medical marijuana. There are some groups that are advocating for it. However, our belief is that, there are other medications that can help. There have
Okay.
been studies nga that say that there are certain elements in marijuana, particularly in some varieties, that can help in controlling seizures, or some of them are even used to abate vomiting or gastrointestinal discomfort as a result of chemotherapy. But there are still other drugs, other medications that are acceptable, that are really being given normally, that have less side effects, that can be used instead of marijuana. We're still very, very far ahead from developing really or bringing out good studies. There are very few studies pa rin.
Thank you for clearing that up, Doctor. Myth number 3, there's no harm in mixing drugs. What does it, what do you mean when you mix drugs?
You remember
This
the actor in River Phoenix?
Yes.
Yeah.
Yes.
Well, he died
Yes.
because of combining 2 drugs. He took heroin and then,
He was very young.
and then I think he took another drug which was counter. Heroin is opioid. So to balance that effect, he took a stimulant. And it's very dangerous. A lot of time people combine medications to try to either control the effect of one or to heighten the effect using both. Normally, even there are some in the normal compendium of medications or drugs and pharmacopoeia, there are drugs that interact with each other negatively or positively. So we have to take that into consideration. So no, it's a myth.
It's a myth. Okay.
be
Doctors,
very careful.
before we, I heard you should always be careful, no? You don't know what you're mixing. You don't know positive or negative, or the opposite might happen to you, just like in the case of River Phoenix. Doctors, we have a caller on the line, Doctor, Professor. Kevin. Hi, Kevin. Good evening.
Hello.
Yes, hi, Kevin.
Yeah, I have a question for you, doctor.
Yes.
My father is a drug user, and yung kapatid ko, he also experimented with marijuana. Is there a hereditary component to this condition, to this?
Yes, there are. There are some studies that have shown genetic predisposition to drug use, and there have also been studies among families that if the chances, if you have a drug-dependent father, the child has a higher chance of developing the same condition. This is also in particularly a study which was done for alcoholics.
Yes, Kevin. Do you have a follow-up question?
No, but yeah, that sucks so bad.
No, but if you need help, you can contact us. I'll leave my number later. We can talk, and we can see what we can do. It's not hopeless.
Okay, thank you so much, Doc.
Thank you,
welcome.
Kevin, for calling. Thank you.
Thank you.
Okay. Professor, Doctor, myth number 4. It takes years for someone to become addicted to a drug.
Some people will be exposed to a certain substance and take years to develop full-blown addiction. But other patients I've seen, they just use a short period of time, sometimes just months, and they are already completely hooked. So it depends on the genetic predisposition again. It depends on the substance being used. It depends on how often and how much you use to set you on the road to dependence.
Yeah.
Professor?
I had a case, isang beses lang siya nag-take, and then dire-diretso na siya until such time na nalaman na lang niya 8 years na siyang gumagamit.
Oh my.
Pabalik, labas-masok sa rehab.
But like you've mentioned, Doctor, no, Professor, it's not hopeless. Like we were talking to Kevin earlier, and
It's
there
not
is,
hopeless.
even if it's been 8 years or longer than that.
You know, I'm very happy to say that, you know, despite the difficulties we find, the challenges in recovery, the patients, you know, we get patients who get well.
Nice.
And it's never a dead-end road, you know? It's never a hopeless. I encourage families, if you have a problem with your loved ones, you know, it's not hopeless. You can always approach. There are certain people who can help you, like Professor, you know. Our center is always open 24/7 for your help, for our help. And together we can work together para I'm being redundant, aren't I?
No,
Pero
but
we
you
can
can
work
never
together
stress
in
it
order
enough,
for us to
Doctor.
be able to help your patients.
Or they,
Yeah.
they can join our discussion as well, and,
Yeah.
and shortly after that, they can get in touch with
Yeah.
you. They can call our numbers at 548-4678, and
Yeah.
they can consult with us online.
Yeah.
Doctor and Professor, myth number 5. Pregnant women can take drugs without having to worry about the harmful side effects.
That's also a myth, of course. When you're exposed to certain substances which are toxic to the body, if you're pregnant, it can affect the baby. Anything you take in the body. Patients who inject heroin who are pregnant give birth to children who suffer withdrawal symptoms. I've seen mothers who are shabu users who give birth to very small for gestational age babies, or babies who develop microcephaly, or very small heads, or anencephaly, cleft lip, cleft palate, mental retardation. These are all a part. There's a study that shows also for marijuana users, mothers who have used marijuana, chances of the baby developing attention deficit syndrome is significantly increased.
And despite all the warnings and
Yeah.
the information being passed on, still a lot of people cannot control their obsession or their
Right,
compulsion to be
right.
dependent on certain types of drugs. Professor,
Definitely.
would you like to add to that?
Yes, yung obsession and compulsion, despite adverse consequences. Yeah, talagang.
So we will continue on the show. We will continue to inform them and arm them with enough the willpower to get out of that addiction, or not to get into any sort of addiction that will be harmful to themselves or their family. We'll talk more about drug addiction, Professor, Doctor, when MedTalk returns.
Despite living a fairly comfortable life under the care of her adoptive parents, life was tough for Michelle Perez.
I myself was rehabilitated 17 years ago.
A series of events shook her world, and soon she felt depressed and miserable.
We started at 12, being adopted. I ran away from home.
This led her to the wrong set of friends and the use of illegal substances.
Marijuana made me sleep and eat, and I was really warping. Syrup made me sleep and sleep and sleep and sleep. Tablets made me want to go to parties. Shabs, for a time being, kept me awake. But later on in my age, I was sleeping and eating. So it didn't have an effect until I wanted more.
By the time she turned 28, Michelle made an important decision to kick her habit, as it was tearing down her relationship with her family and negatively affecting just about every facet of her life.
We're back here on MedTalk, still talking about drug addiction. Aside from Dr. Alfonso Villaroman and Professor Rodrigo Lopida, we have on board Ms. Michelle Perez, the owner and founder of Bridges of Hope Rehabilitation Center. Again, you may join the discussion by calling our hotline at 548-4678. Hi, Michelle. Welcome to the show.
Hello.
Thank you for sharing your story with all of us.
I know. It's honored to be here. Apparently, it's always doctors. I've watched Eating Disorder.
Yes. Oh,
Yeah,
thank
your
you.
segment on eating disorder.
Yes.
And it's always doctors, so I'm honored.
Thank you. So, you've watched the segment on an eating disorder. This one is a disease/disorder that you were faced with at an early age of 12. You were in high school.
First year.
Oh my.
Grade 6, first year.
What was it, briefly, what was it like? How did you get into this type of addiction?
Well, apparently I had my own problems. It was a problem at home, but basically I searched for the high. I wanted to get higher and higher and higher. So it started from there. Then I wanted to stop having problems. Instead of stopping, I started gaining more problems. Then came pregnancy, then add on. Drug addiction, added more things. Like I started with cigarettes, marijuana, tablets, syrups, then it went on.
And would you mix these? Would you have a certain preference for the addiction?
I would mix marijuana with sleeping because I was up and getting really warfaric.
But warfaric, yun na nga yung sinasabi na sa doctors.
I'm not high, doc.
You're high on sharing with all of us that there is
different high.
a different kind of high this time. But you finished school, no? If you started at 12 and the addiction did not hamper your schooling or a career?
It
did.
Apparently, I had very supportive parents.
Okay.
Again, I would suggest that if one has a problem at home, then I guess support, because I had a good support. I had family, my dad, my mom. Every time I'd feel like taking, I'd just go to my parents and they'd do something about it. So the support was there. So later on, they just convinced me to go back to school.
And you did.
And I did.
And you finished school.
Pahirap pa.
But you did.
Yeah.
Pero after that, you were taking all these drugs, and then
No,
you
even
wanted,
during.
during, and then you wanted to stop. Kusa, did someone tell you that it
I
was
went
bad
to
for
my
you?
sister one night and told her, I don't like na.
How old
Kasi,
were you then?
27. I was tired. Nakakapagod. I mean, anybody who's taking would know what I'm saying. Nakakapagod. The ritual, everything, they would know what I'm saying. It's tiring because I was losing friends. You don't know who your friends are. And they're just there hanging around with you because, you know, they want to take. Or because they're also high. Things like that.
Same interest, so to speak, the bad kind of interest. Dr. Villaroman, I understand that you met Michelle at the rehabilitation center. Please share with us that meeting.
Michelle is one of the few success stories I've seen. When I first saw her in the center, she was really, should I call you a mess for a piece of work? Pero no, she was really addicted, and her behavior was geared more towards manipulating people to get out or to gain favors, you know. And this is the same behavior that we see for drug dependents outside. They're manipulative, they go out of their way to mooch people para makakuha ng pera to use drugs. Michelle had this asset of being very charming, you know. She's very talkative, she talks well with people, and she uses that effectively. But, you know, as she went on with the program, we started learning things slowly but surely. Of course, you expect mistakes to be made, but what's important, she rose from the mistakes. And until later on, you know, she went out there was still a lot of trials, I believe, no? I lost track of her after she left, but from what I heard, she was still struggling. So going out from a rehab center to the outside world is difficult. You have to, there's a struggle, you know? There's still this giyang, the urge to use drugs. Fortunately, like I said, one of the key elements in successful rehab is to have a very good support group. And the basic support group that we are trying to always empower is the family. Sa kanya, she had a very good support group embodied by her family. So, nakatulong yon. And, of course, there will be times that she'll crave for the drugs. But as time goes on, you know, nawawala yan unti-unti. And what made it better, because she developed this resolve to help people as well. I know a lot of people who are successful in recovery who established drug treatment centers also, and they're doing good. You know, sometimes it takes a knock on the head to set the pace for you to improve your life.
It's true. And off-cam, Professor and I were talking about willpower. It takes more than that, no? Siguro, Michelle, talagang sobrang dami willpower, for the lack of a better word to use, when you decided to kick that habit.
My willpower was, I'm adopted. I don't think my parents who adopted me deserve what I'm doing. And plus I have 3 kids. That for me is enough. Apparently, Doc was right. During the years, I did struggle with health and a lot, with studies, health, everything. Loneliness abroad, because my parents sent me there, so I don't take anymore. Their support was really, saludo ko sa parents ko.
You're very lucky.
Saludo ko.
At ngayon, saludo na sila sa'yo, because now you're the founder of Bridges of Hope Rehabilitation Center. Not only your parents, but to those around you who you have been helping for the last couple of years.
The rehab was later on na eh. I was in Canada when I was asked to come back to open one.
You in Canada because they sent you to Canada.
My dad told me, the school called me for an interview. And they said, why not study and everything? And they're willing to accept me. And my dad's like, since they're willing to accept you, that means you have the brains. And I'm like, okay. So, okay, I'll do it. And then my dad just sent the rest of my stuff. So apparently I was left there.
And then you had to come back. Professor, let's go to Professor Lopida.
I'd like to add that
to this.
Codependency can also develop. Being affected by somebody else's addiction can cause somebody to suffer from depression also, anxiety, and other problems.
So you suffered from all those that Professor Lopida mentioned?
I had no codependency.
No codependency.
More or less, I did everything what Doc Poch said. Headstrong. There, like I said in the interview, there are different kinds of people. You know, everybody's unique in their own way. I myself am not the type who depend on someone just to take. But he told me way long ago, I don't know if you can remember, he said, I'm easy to persuade.
Doctor said that to you.
Very, very impressionable.
Yeah. So, which is also a dangerous thing. It means if you're easy to persuade.
She cannot say no.
Yeah.
But
that was then.
So it's ngayon, how would you describe yourself now?
Now
Yeah.
I can say I've learned from the hard way. You know, something I can't share because everybody has to go through the hard way. Doc Poch said, knock on the head. Yeah, it did knock me on the head. I had, you know, all kinds of accidents. And yeah, it did knock me on the head. But my parents' support was the key. It was the key. I strongly suggest, you know, every time a parent calls me and asks me, what can I do about my son or daughter or husband or wife or whatever, I'd always say support them with love. Minsan kasi they give up eh. They'd say, I'm fed up, but you know, you're supposed to motivate them, not to get fed up
with them. Briefly, before we cut to the break, you know, encouraging or supporting someone to go seek help is also difficult for the parent or the brother, the sister, the husband, the child. You know, parang in a way you'll think that you're letting them go, that you're leaving them.
You know, Professor was mentioned about codependency. Codependence is a situation where the loved one or the person related or intimately associated with the patient develops problems also as a result of his addiction or her addiction. Hindi necessarily to take addiction and drugs, but it can lead also to him suffering from depression or other problems. And at the same time, during treatment, it's so difficult kasi to have the patients to rally or to involve patients in the program. In fact, when we rehabilitate patients or treat patients, we treat the family as well, because addiction is a disease or sickness of the entire family. Apektado sila. So you have to really work not only on the patient but on the loved ones. So we always involve the families in the treatment.
Okay, so we'll talk about the treatment and how families should be involved, or how the involvement of each member of the family in helping the patient recover from this addiction. Professor Michelle, Dr. Villaroman, we'll talk more about that when MedTalk returns.
Did you know that using shabu can result in impaired verbal learning, reduced motor skills, severe dental problems, extreme weight loss, insomnia, and confusion?
We're back here on MedTalk, still talking about drug addiction. This time, Dr. Michelle and Professor, we have another caller on the line, Jean. Good evening, Jean.
Good evening, ma'am.
Hi, yung question mo para sa mga guests natin.
Yes, ma'am.
Please go ahead, Jean.
The question is for your two visitors, doctor and sir. My husband is drug dependent for 20 years, I think. Simula pa lang pong nagkasama kami. But we're not together this moment. My question is, kasi he was rehabilitated 1 year, last 2004 to 2005, but paglabas po, the same pa rin. What can we do for him? When in fact, hindi naman po siya humihingi ng help. Hindi rin siya umaamin na ganun siya. And one of my problem is also the relatives of my husband. They're not enthusiastic on rehabilitating him.
Okay, thank you, Jean. Dr. Villaroman.
Yes.
Yeah. Good evening, Jean. One thing I can say na ang problem kasi ng drug addiction, it's chronic. And a lot of times, patients will be in denial. They will either downplay their addiction or they will deny that they have a problem altogether. The common cliche that we see is, wala akong problema, kayong lahat lang ang may problema. So, it's a challenge itself to try to convince a person to enter into the program of rehabilitation. Far more difficult it becomes pag ang relatives mismo are uncooperative. Pero Jean, my advice is, you are the wife. Ikaw ang pwedeng mag-decide for your husband, who has probably already gotten too far deep that he will really need help. If you really love him and you really want him to, your relationship to stay, your family to grow, your children to see their father grow old, it's important for him to get back into a program. A lot of times, they get out of residential program and they don't come back anymore for aftercare and follow-up, which is very important. And these are the things that we've often seen. A lot of patients come back to us because hindi sila nagkakaroon ng proper follow-up. Wala silang support group. They go back to their old friends, to the same environment. Sooner or later, or before you know it, they're back into using. And it's going to be the same old thing. And if you don't solve that, it's going to be like a revolving door.
Professor.
Okay.
I'd like to add, Jean, that doctor is right that the program of your husband is not complete because 1 year nga lang siya nag-stay sa rehab plus wala siyang aftercare and follow-up. So napaka-importante na makumpleto yung rehabilitation para mas magiging maganda yung chance na siya ay magbago.
But I'm telling you, Jean, hindi lost yan. We can try to convince the family to involve. It would be better kung pati yung mga kapatid, mga parents, encourage na matulungan yung pasyente. A lot of times, they just don't care anymore because they're just too sick and tired of the problems that happened, no? Jean, ikaw ang susi. If you really want to help your husband, you know, we're around, you can call us, we can help you, and we assure you that we will do everything we can para matulungan namin ang iyong asawa.
I'd like to add that
yes.
in every patient, there is what we call cry for help.
Yes.
Meron niyang chance na, meron niyang panahon kung saan siya ay talagang humihingi na ng tulong. At hanapin mo lang yon, Jean, at for sure ay matutulungan natin.
Yeah.
Jean?
I have a follow-up.
Oo, sige, go ahead.
Dr. and Sir, meron po lalapitan sa government kasi he went to Bikutan in QRED before. Kung doon ko po kasi dadalhin, hindi po niya na siya doon.
Yes, Jean, actually, I'm the program director of the DOH-TRC Bikutan now, and it's run by the Department of Health. Please contact me. I'll leave my number, and I assure you that everything it's much different now. Nagbabago na ang ating kaalaman, nagbabago na ang ating protocol para sa pagtitreat ng mga pasyente. We are becoming more clinically oriented, and we are using a very good modality, which is TC. I'm sure, I think Michelle is familiar with that.
Yes.
It helped her too. So please, contact me.
Yes, sir. Thank you very much.
You're very welcome.
Thank you, Jean. Maraming salamat.
Thank you very much, ma'am.
Okay, thank you. Okay, again, we can't stress enough that it's not hopeless.
Yes.
No matter how far along you've been taking
Yes.
these drugs, these substances, there is hope, and there are certain steps to take in order to get there. So, where do we start? Where does one begin?
Usually, for a patient, it starts when they realize that there is really no way for them to do anything but to go for help. Unfortunately, a lot of times patients are brought to a facility without their knowledge or ayaw nila, against their will. We have developed a lot. In the Department of Health Treatment and Rehab Center in Bikutan, we are manned by experts, psychologists, social workers, doctors, nurses, and other experts who can help your patients. We are the biggest center by far with regard to population. Right now, we have almost 1,000. But during the time that Jean was mentioning before, they had more than like up to 3,000 umaabot sila nun. And I can understand the situation that your husband was in, and he can develop certain aversions to going back to rehab. But I assure you that, you know, it happens talaga na pag na-experience niya ulit yung road to recovery, it is going to be a new addiction for him. The addiction to stay sober.
Nice, yes. Yes, Professor.
For those who are into rehab, they say, tatlo lamang yun eh. Tatlo lamang ang patutunguhan.
Yeah.
Jails, institutions, or death. Tatlo lang yun.
And we want those patients to be rehabilitated. We want them to have a better life, better quality of life. No? And whether you take, there are different types of treatment, I understand. There's talk therapy, there's medication.
Yeah, there's pharmacotherapy for certain patients, especially with comorbid disorders. You can do that. But now we approach in our center, I'll speak for our center, we use biopsychosocial approach.
What exactly is this?
It entails involving management not only for the body, pati yung relationships mo, at saka yung mind. And of course, yung spiritual. Importante yan. We're not inkling to any religious belief. It's spirituality kasi. It is the essence of the goodness of man. Okay? So, our modality is actually therapeutic community. It's TC. But it has evolved so many years. Ngayon, nung araw, uso yan, mga blasting, yung mga, para silang nagsisigawan.
Okay.
Ngayon, it's
a
tame.
gentler approach, would you say?
We use a more, I'd say a more professional approach.
A more professional approach.
And it's evidence-based, and that's what's important. Because, we need good backup of experts. And then we also don't tire in looking for new innovations within the modality that we are using. Kaya importante ang research.
And each individual, no, Michelle, iba-iba ang take or iba-iba ang view on how to go about the rehabilitation. No? Each individual, iba-iba talaga. So the rehabilitation centers will zero in on specific needs?
We usually are, right now we're developing like treatment plans for them. Kunyari, kung may anger issues or, dependency problems with other things, tina-target namin yon para meron kaming realistic goals.
Okay. Thank you very much, Dr. Villaroman. Michelle, any last words, any message to all our viewers out there before we go?
I would give one message. Right now, people are having a hard time going back to society. And true that we do need support, but I'd also like to ask from the public that don't judge us in saying that galing kaming rehab or automatically we're getting blamed. Sure, we did it, it's our karma, we did some trauma to them, but apparently there are some people in society that says kami na nagnakaw, even though we don't know them, or, just judging us. I would like to tell them if they have not sinned, cast the first stone.
Okay. Thank you, Michelle. Professor?
Gusto ko lang sabihin sa madla na ang addiction ay hindi bisyo. No? Hindi ito isang bisyo. Ito ay isang sakit na kinakailangan mabigyan ng karampatang gamot. Karampatang gamot o lunas sa lalong madaling panahon.
Okay. Maraming salamat. And for those who would like to get more information on your rehabilitation center and to consult with you, doctor, and to seek more information, they can call our hotline at 548-4678. Even if we're not on the air anymore, someone will answer and we'll give them the corresponding reply. So thank you once again, Dr. Villaroman. Michelle, maraming salamat. Thank you for sharing your story and being an inspiration to all of us.
I'm happy to oblige.
Thank you very much, Professor, as well. See you again next Tuesday, 7 p.m. on your scheduled on-air consultation here on the Solar News Channel. I'm Angel Jacob. Good night. these consequences or the detriment to one's health, there are still a lot of people who are addicted to these types of substances. Why is that? Why is that so?
It's masarap eh. Really,
Okay.
it gives them a high, the euphoria. I'll give a good example. It's the stimulants, particularly methamphetamine hydrochloride, which is more commonly called shabu. When a person is exposed to that substance, he will feel an intense euphoria. It's a stimulant. So, ang feeling niya, he feels strong, invigorated, he feels tireless. In fact, a lot of professions that entail long hours of work, like driving long distances, or even working in studios, or security work. These are people that are prone because they feel that their function is enhanced. The problem is it sets the stage for changes in the brain, particularly, because when you take shabu, there is a flood of neurotransmitter or chemicals in the brain that cause this severe or extreme euphoria. So this is not normal because normally we have chemicals that make us feel good. And it attacks targets in the brain, particularly those for pleasure and memory and learning. So addiction, some say that once you're exposed, you're on the road to addiction. But there are some people that are genetically predisposed to addiction, and studies have shown this. Some people might be exposed to it is actually part of a mental disorder. It is a mental health disorder. But aside from that, it's more complicated than that because if you use the drug or use drugs constantly, it can also affect your body. You can develop symptoms like, for example, HIV for IV drug users, or you can develop other disorders. There's one common problem that we see in patients constantly using meth. It's called meth mouth. The teeth fall out, they decay. Aside from that, they develop other disorders like cardiovascular disorders or renal disorders as a result of constantly using drugs, or even other medical problems.
Yeah, it is also included in the DSM, or the Diagnostic and Statistical Manual for Mental Disorders, and also ICD-10. So
What is the
chemical
ICD?
dependency is also included there. The International Classification of Disorders and the Diagnostic and Statistical Manual for Mental Disorders.
Actually, it's a basis for psychiatrists and addiction specialists use DSM and ICD-10 as a basis for diagnosing patients. One of the highlights of DSM, it's actually dalawa yan, American ang DSM, ang ICD-10 is British. But one of the highlights of DSM is, for example, continued use despite yung detriment to health, despite continued use despite legal problems or consequences, continued compulsion to use, symptoms of withdrawal, and others. So these are part of the things we find in the DSM classification.
And in spite of all the...
Because of the drug use.
Yeah, it is also a disease of the body, the mind, and the spirit. And it is characterized by obsession, of course. to
Naku,
drugs.
when one is really obsessed with anything, you really have no control over your mind, your body,
Yes,
and your spirit.
definitely.
And how does this obsession develop? How does it start,
Well,
Dr. Villaroman?
Obsession, we may call it, I would rather term it as compulsion to use drugs. A person dependent on drugs usually manifests with behavior that he constantly seeks to use drugs, to obtain drugs and use. Hinahabol niya yung satisfaction, yung high na nakukuha niya. This is a result of changes in the body, particularly in the brain, that occur because of continuous drug use. The professor was right in saying that it is a sickness of both the body, the mind, and the spirit, because lahat yan na nagiging complications. At the same time, because of the constant drug use, affectado rin yung normal function ng patient day to day. naapektuhan yung kanyang work or study. He's unable to cope with the social demands that are given to him. He develops problems like unemployment, becomes out of school. He also develops legal problems as a result, probably from stealing or doing other things that target obtaining money to buy drugs.
So because of all these factors that affect this individual, has it become, or is it a disorder? Is it a
Yes.
disease? How would you classify it?
Actually,
in
we
medical
classify.
This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Drug addiction. It's a vicious cycle you do not want to get into.
It entails the fact that you are taking an illegal substance or medication, and then you tend to abuse that medication or illegal substance.
According to the Dangerous Drugs Board, 1.7 million Filipinos are hooked on dangerous drugs. The most commonly used illegal drugs and substances in the Philippines are methamphetamine, hydrochloride or shabu, cannabis or marijuana, and inhalants such as rugby and contact cement. The red flags are just about everywhere.
For instance, shabu. The dependence, hindi ko minsan nakokontrol yan eh. Kasi you will feel yung the pleasure, the feeling of being relaxed, the feeling that you forget your problems, tapos nawawala yung stress mo. Akala mo lang yon. And then, once na you're hooked on it, eto na yung possibility na magtutuloy-tuloy na to into addiction.
Drug addiction can destroy your family and can interfere with your work and relationship with other people. Everything starts with an active decision to understand the harmful effects of these dangerous drugs on your physical and mental health.
Giging disorder kasi hindi mo mapigilan yung thoughts mo na kailangan mag-take ako nito kahit na hindi kailangan. Such compulsion can produce anxiety, can produce panic, may stress out ka, magkakaroon ka ng tension, restless ka, until you become aggressive na to the point na parang hindi, tapos uncontrollable na yung behavior.
What are other drug addiction symptoms or behaviors? What are some long-term consequences of drug addiction? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Alfonso Villaroman, an addiction specialist and the program director of the Department of Health, Treatment and Rehabilitation Center in Taguig City. Also with us is Professor Rodrigo Lopida, a certified counseling psychologist and a licensed psychologist from the Center for Christian Recovery and Agape Rehabilitation Center. You may join our discussion by calling our hotline at 548-4678. Good evening, Professor. Good evening, Doctor. Welcome to MedTalk.
It's nice to be here.
Tonight's topic, drug addiction. How would you define drug addiction?
Well, drug addiction is a condition of a person where he continuously reuses drugs, despite detriment to his health, despite health problems, legal problems, or other problems that may entail